So you arrive on the scene where a 57-year-old man is complaining of chest pain. He is pale and sweaty.
Okay, so first things first, I'm going to make sure that I have all my PPE on. I'm going to ensure that the scene is safe.
Mm-hmm.
Scene is safe?
Yep.
Okay. And then I'm going to see that my nature of illness is I have a 57-year-old male in front of me. I can just tell that he's sweaty, so I'm not too sure what's going on yet. I'll have to get more information. I'm going to consider additional resources and going to consider C-spine. By doing that, I'm going to approach the patient and introduce myself. Hello, sir. My name is Brian. I'm with EMS, and you gave us a call today. What seems to be the problem?
My chest really hurts. I have angina, but this pain is worse than any I have ever felt before.
Okay, so I know that my patient is alert. The airway is patent because he's speaking in complete sentences. I'm going to ask some other questions. Can I get your name, sir?
Bob.
Bob? Okay. And where are you at, Bob?
In my house?
You're in your house? Okay. And do you know the year?
Yeah, it's 2021.
2021. Okay. And do you remember why you called us today?
Because my chest hurts.
Because your chest hurts. Okay. So I've established that my patient is 4 out of 4 on the aptitude scale. They are alert and conscious. I'm able to answer all of our questions. Let's see. I know that now I'm going to assess for any imminent life threats. Is there any life threats?
Cardiac compromise.
Cardiac compromise, okay. I'm going to go ahead and assess my EBCs. So I'm going to, is it okay if I put my hand on your back?
Mm-hmm.
Okay, so I'm going to assess my breathing with my respiratory rate and my quality.
24 and shallow.
24 and shallow, okay. So given that information, I'm going to go ahead and I'm going to apply oxygen therapy, 15 liters per minute with a non-rebreather mask, okay. I'm then going to check for any obvious life-threatening bleeding.
No bleeding.
No bleeding, okay. And then I'm going to go ahead and I'm going to check my patient's pulse and their skin condition. May I have your wrist for a moment? I'm going to go ahead and check your radial pulse.
Pulse is 124 and weak.
Okay.
Skin is cool and clammy.
Okay, so given that information, I know my patient is showing symptoms of shock. So I'm going to go ahead and I've already started treatment with the oxygen. I'm going to go ahead and I'm going to take a blanket and I'm going to apply the blanket to help keep their body temperature. There, you're warm.
Mm-hmm.
Okay. At this point, my general impression of the patient is poor. I know that they do need to be transported immediately, so we will go ahead and we will transport.
Now we're in the ambulance?
Now we're in the ambulance. I'm going to go ahead and go through my OPQ RSTs. Sir, when did this chest pain start happening?
It woke me up from my afternoon nap.
Woke you up from your afternoon nap, okay.
Mm-hmm.
And does anything make the pain worse or better?
It hurts really bad, and nothing I do makes the pain go away.
Okay, so sitting, resting versus walking, it's all the same?
Yeah.
Okay. And can you describe the pain to me?
So it started out like indigestion, but it's gotten a lot worse. It feels like a big weight is pressing against my chest, and it makes it hard to breathe.
Okay, so a lot of pressure on your chest?
Mm-hmm.
Okay. And does it radiate anywhere else in your body? Is it just your chest, or is it going anywhere else?
Well, my shoulders and my jaw started hurting about 10 minutes before you got here, but the worst pain is in the middle of my chest, and that's why I called you.
Okay, sounds good. And on a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, 1 being little to no pain, can you describe that for me?
This is the worst pain I've ever felt. I can't stand
So
it.
you're at 10, okay. And has it, when it came on, did it start out as a 10, or has it been getting, has it kind of receded and come back?
I've had this pain for about an hour, but it seems like days, and it's been 10 out of 10 all the
It's been
time.
10 out of 10 the whole time? Okay. So I know that my signs and symptoms are chest pain, and he also has some shortness of breath as well. At this point, I'm going to ask for his allergies. Do you have any allergies to any medication?
No.
No? Okay, and are you currently on any medication?
Nitroglycerin.
You're on nitro, so you take nitro for your angina?
Yep.
Okay. So I'm gonna make a note of that. And then, what was, as far as your past medical history goes, have you seen a doctor for your angina, and how long have you been seeing a doctor for your angina?
So I was diagnosed with angina 2 years ago.
Okay, so it's been a couple years now?
Mm-hmm.
Okay, and have you been to a doctor recently?
Yes.
Okay, about how long ago was that?
2 months ago.
2 months ago? Okay, so you've seen a doctor within the last couple of months?
Mm-hmm.
Okay. And then, when was the last time you had anything to eat or drink?
I had soup and a sandwich about 3 hours ago.
Soup and a sandwich about 3 hours ago, okay. And I remember you said that you were taking a nap, so that's, had you been doing anything before you laid down, any kind of strenuous activity, anything like that?
No, it's just a lazy Sunday.
Just
I was
lazy Sunday, just
eating
laying
and
down and
taking a
don't
nap.
wake you up, okay, sounds good. So at this point, we're gonna go ahead and we're gonna start our secondary assessment. I'm gonna go ahead and reassess the patient's breathing. I'm gonna go ahead and listen to all 6 points. Oh, that's not.
That's okay.
Shoot.
I think
I got no timeout, but
I think you can just verbalize, right? Or do
Yeah,
you,
you can definitely just
I can verbalize it, okay.
I didn't realize what was going on.
Yeah, no, it's okay. So I'm gonna reassess my patient's breathing. I'm gonna be checking all 6 points, mid-clavicle between the second and third intercostal, mid-axillary, and then inferior scapula on the back. And what is the patient's quality of breathing?
The respiratory rate is 24 and in shallow.
So still 24 and shallow, okay. And then I'm gonna go ahead and I'm gonna recheck my patient's pulse.
124.
And I'm gonna recheck their skin condition and temperature.
Still pale and clammy.
Still pale and clammy, okay. And then, so I'm gonna go ahead and I'm going to ask him if I can palpate his chest. I'm gonna expose, look for any signs of skin condition and or hives. I'm also gonna look for any abnormalities, scars, any kind of cardio implants, like pacemaker or internal EAD or EED, sorry.
There are no abnormalities or any significant findings.
Okay. So I'm going to go ahead and I'm going to obtain blood pressure.
It's 144/92.
144/92. Okay. And we'll go ahead and I'm also going to apply pulse oximeter and get an oxygen reading.
I don't know. We'll go with 95.
95. Okay. Since it sounds like a cardiovascular or a cardio event, I'm not seeing the need to check for blood glucose at this time. Let's see, so so I know we're cardiovascular. I'm going to go ahead and I'm going to contact medical control, and I'm going to let them know that I've got a 57-year-old male complaining of chest pain. He has a history of angina. When we showed up at his place of residence, he was sitting on the couch. He said that this pain woke him up from an afternoon nap. He is on a scale of 10. His ABFU is 4, his GCS is 15. He he is prescribed nitroglycerin. And actually, Serge, have you taken any of your nitroglycerin?
Yeah, I took my nitroglycerin about 15 minutes ago, but it didn't make any difference.
Okay, and how many did you take?
Just one.
Just one pill? Okay.
Yeah, it's always worked before.
Okay, so let them know that he has taken one dose of nitroglycerin and it's had no effect on his symptoms. And I will see if they want me to administer another dose.
Okay. What would be the indications of administering another dose of nitroglycerin?
His his blood pressure is over 100. There's no contraindications as far as the blood pressure goes. I would also need to ask my patient, are you on any sort of erectile dysfunction meds like Viagra,
Nope.
Lutro, I think is in Cialis? No? Okay.
Nope.
Okay. And I believe that's it as far as contraindications go for the nitroglycerin. So I would ask them, I would see if I got clarification to administer another dose in this instance.
Yeah.
They said to go ahead and administer another dose?
Yeah.
Okay, so I would have to do my 5 rights, make sure that I've got the right drug, which is nitroglycerin, 0.4 milligrams. I would make sure that it's the right patient. Obviously, my patient is in cardiac crisis, and so I know that nitro is the right thing to give him. I want to check the expiration date, make sure that it is not expired, and then I want to make sure that he is taking it via the right route. I will take one nitroglycerin, put it in the cap, hand it to my patient, and have them put it sublingually. So, sir, if I could have you go ahead and we're going to go ahead and do another nitroglycerin pill. I'll have you place it under your tongue. Please do not chew, do not swallow, just let it dissolve under your tongue.
Okay.
Okay. And then after that, we're going to recheck my patient's vitals every 5 minutes because he is in cardiac crisis until we reach the medical facility. I know that my field impression is that I have a 57-year-old male. He is in definite cardiac crisis. He's has a history of angina, and he has been administered 2 doses of nitroglycerin. When we get to the medical facility, I'm going to make sure that I give my full report, including all my vitals and all my patient information, his history, medical history of angina, everything like that, to a qualified nurse and or attending physician. And that will be the end of my report.